IV placement in the bicep is honestly one of my favorite positions. Typically, but not always, the veins in the bicep are larger than the veins in the lower arm, and I like the position because the patient can bend their elbow and it won't do anything to the IV. Regardless how big the vein looks, I always tap, rub, flick, just to get the vein that much bigger. Having the patient make a fist is always really helpful, so if they're conscious and able to, I always ask them to. Also, after you're done rubbing the alcohol wipe, make sure that you allow the area to dry before you insert the needle. If you're using a BD Nexiva, make sure to open and close the seal by retracting the needle slightly and then placing it very carefully back. Opening that seal before IV insertion is going to make threading with the Nexiva so much easier. If your patient's cooperative and you're not concerned of them moving their arm, you can actually check for IV placement even before putting the tegaderm on. This way you know for sure that it's in the right spot before you place the tegaderm, because if it's not placed correctly, the tegaderm removal oftentimes hurts more than actually the IV. And when you're checking this without the tegaderm on, just make sure you're careful not to move around the catheter. And as the blood disappears from the tubing and you don't see any infiltration anywhere, the patient's not complaining that it hurts, now you can place the tegaderm on with full confidence of your IV.